Independent financial planner and wealth advisor with Stratos Wealth Partners. I want to thank you for joining me today. Our topic tonight is protecting wealth for an aging America, and this is essentially a series of webinars that I do, essentially one per month, on different topics that I think might be of interest or value to either my clients or maybe somebody that is looking for a financial advisor. So look for this to be different topics to be repeated every month. I will share with you that this is being recorded. I should have everybody on mute, and I will record this and upload it to my YouTube channel probably tomorrow. So if you go to my website, BriantSikorski.com, and click in the upper right-hand corner on the YouTube icon, it'll take you to this presentation, which is being recorded, and you can watch it again later at your convenience. So with that, again, the topic here is protecting wealth for an aging America. Interestingly enough, the topic, or the title of this presentation actually changed. It was actually previously called Financial Planning in the Shadow of Dementia, which I thought was kind of interesting because this presentation, which you can see in the lower right-hand corner, is provided to me by Transamerica. It really changed, from my perspective, the focus of this presentation. It really brought to light this link between my clients' health and their wealth. And so today we're going to look at some of the research that the MIT Age Lab, in collaboration with Transamerica, came together. And I'll share some of the financial concepts that you should understand and several key questions you will have when trying to create a financial strategy for or with a loved one living with Alzheimer's disease or another type of dementia. So developing these strategies for someone affected is really no small task. The financial details can be difficult to keep track of when your loved one's comfort is your first priority. And so I've been in the Cary, North Carolina area for about 6 years now, and I have seen a tremendous increase in the number of people that are getting into this caregiving type of industry. From home health aides to downsizing managers to move managers to geriatric nurses. So very interesting to see how, as that baby boom generation starts to reach retirement and then moving into periods where they need some assistance from some type of caregiver, you just see the influx of people into that market. Now, myself personally, my mother, well, let me take it back 2 generations from that. My great-grandmother was pretty much fine until she was probably in her 80s, and then she went from living at home essentially into a skilled nursing community, back then called facility, or a convalescent center, that's what they called it. And her costs were entirely covered by my father's benefits, as he was an employee at Ford Motor Company. Then her daughter, which was my grandmother, that was my great-grandmother, my grandmother, she moved in with my mother. My mother moved her in with her in order to be a caregiver for her. And then for my own mother, she was brought into my sister's house. So here we have, I'm thinking specifically of, 3 generations that have needed some aspect of assistance. And, only one of them, which goes back 2 generations, was cared for in a convalescent center. So this material was presented in collaboration with the Age Lab at the Massachusetts Institute of Technology, the Alzheimer's Association, and a certified financial planner. Here we see Stephen Sarnes. This MIT Age Lab in Cambridge, Massachusetts was founded in 1999, and its objective was to study the effects of aging and the societal impacts on an aging population. Age Lab researchers have helped companies, organizations, government agencies worldwide generate new ideas, and they've developed new strategies and technologies to address the issues of an aging population. In 2013, here's where Transamerica gets involved. They reached out to the MIT Age Lab director, Joseph Coughlin, and asked him, based on your research, what one aspect of aging do you believe has the biggest impact on the financial services profession today? And his response was clear and to the point: Alzheimer's and dementia. The disease not only robs people of their ability to manage their financial affairs, it also creates many practical challenges for their families. So in addition to collaborating with the MIT Age Lab, Transamerica developed a working relationship with the Alzheimer's Association, formed in 1980 with the objective to eliminate Alzheimer's disease through the advancement of research. So why should we care about this? Why should we pay attention to this? Well, some would say that Alzheimer's in of itself is an epidemic, and that it's very likely you or someone you know already is or will be directly affected by the disease. According to the Alzheimer's Association, nearly 6 million Americans are living with Alzheimer's or some other type of dementia, and about 200,000 of those are living with younger onset Alzheimer's, meaning the disease developed before age 65. In total, 1 in 10 Americans over age 65, about a third of the people age 85 or older, are living with this disease. And unfortunately, someone in the U.S. develops Alzheimer's every 65 seconds. So Alzheimer's and dementia are serious issues that affect all of us. At this point, you might be asking, well, what's the difference between Alzheimer's disease and dementia? Well, dementia is not a specific disease. The Alzheimer's Association defines dementia as a general term for a decline in mental ability severe enough to interfere with daily life. And memory loss is an example of this. Alzheimer's is the most common cause of dementia, accounting for an estimated 60 to 80% of all cases. It is an irreversible, fatal brain disease that damages nerve cells and slowly robs people of their memories, thinking skills, and ability to complete just very simple tasks. And being a caregiver is the ultimate act of love, but it can also take a mental, physical, and emotional toll on the person providing the care. So let me take just a moment to remind you that it's important to focus on your own well-being, because a stressed caregiver is less able to provide quality care to someone living with dementia. Now, for anyone who is attending this webinar, I will be sending out an accompanying caregiver guide and a caregiver checklist. And in that, it does have a list of signs of caregiver stress that the Alzheimer's Association suggests you look for. And the guide also gives you tips on how to manage stress. I remember one time I gave this presentation, in person, and I said, it kind of reminds me of if there's a loss of pressure, or compression on an airplane. What happens is the masks fall down, and what do the flight attendants tell you to do? Well, to put your mask on first, and then put the mask on the child. So there is some parallel there that you can't ignore your own needs, or you're not going to be in a condition to care for that loved one. So some of the roles that we find caregivers performing include things like household chores, transportation, or managing finances. But what if you're not serving as a caregiver just yet, and you're just beginning to notice that a friend or a relative is starting to act a bit differently? And starting that conversation can be difficult, but it's vital to developing a plan for the future. So here's a few tips to consider if you suspect someone might be experiencing difficulties. Number one, recognize the person might know that something is wrong but is embarrassed by it. The individual might be worried about losing his or her independence, and then others are going to start telling him or her what to do. I remember on my mother's side of the my wife's side of the family, her mother lived in a caregiving community. I would almost say it was almost more assisted living than skilled nursing, but one of the deals was for her to move in was they had to agree to let her keep her car. Now, she couldn't drive it, and she hadn't driven in years, and she even didn't have a driver's license. And so what the kids did is they parked the vehicle outside her window in the parking lot so that she could see it. This is, again, my wife's mother, my mother-in-law, so that she could see that vehicle and knew that she was not trapped there. If she wanted to get out and get in that car, I guess she could do it, although I don't think they left the keys for her. But nonetheless, you can see what a huge factor that little thing was to her. Second, show empathy and reassure the person that you're there to support them and provide the necessary help. Talk about how you want your loved one to have a say in the decisions that affect his or her life. And you want to do everything possible to help keep the person independent as long as possible. And lastly, recognize that it may be important for them to see a doctor. And this will help them get and take advantage of available treatment sooner than they probably would if they did not consult their family physician. I have even seen, in all honesty, where some people have taken the loved one to the doctor and have the doctor, to some extent, break the news. Everybody in the room kind of already knew it, but it took the doctor to voice it because that person, being older, was part of that greatest generation that respected authority figures. So that even though the child or other caregiver could say, you are experiencing X, the person would refuse to acknowledge it. When the doctor said, you're experiencing X, the individual would say, yes, you're right, I have. The earlier you start your conversation with your loved one, the better off you and the family will be. And I'll get to that in a little bit more detail in just a minute. First, know that Alzheimer's and dementia involves three basic stages of cognitive decline: mild, moderate, and severe. You can also think of these as the early, middle, and late stages, and each stage has its own specific characteristics. In the Caregiver's Field Guide to Financial Strategies for those living with dementia, which I'll be providing, it describes in detail several actions you should take during each of these phases. Now let's get to why it's important to start this conversation sooner rather than later. If you only remember one thing from this presentation, please remember this. Due to the progressive nature of Alzheimer's disease and dementia, preparing must begin as soon as possible, in the mild stage of cognitive decline at least, because the window is closing for your loved one to participate in the necessary conversations about his or her future. In other words, if preparing begins too late, the person with dementia may not have his or her wishes about finances, care, or future living arrangements fulfilled. So during the earlier or moderate stages, even the mild stages of cognitive decline, you should really work on your loved one to begin pulling together a strategy. So this brings us to that bringing a strategy with our 5 areas of focus. Number one, we can see here that we have identified assets. So the researchers at MIT Age Lab have developed a framework that includes 5 topics families should discuss when developing financial strategies for loved ones living with dementia. These topics, including assets, income, insurance, intentions, banking, administration, and care management, cover distinct financial management issues and caregiving plans. The first 2 categories, assets and income and insurance, represent your loved one's revenue sources. The third, intentions, refer to helping your loved one articulate his or her plans and wishes. The final two categories, banking and administration and care management, represent how money will be handled and spent. This includes strategies for day-to-day expenditures and expenses for care. It's important for you to understand that the source and destination of your loved one's money so you can help when the individual may no longer be able to communicate his or her wishes. Ideally, you will work with a financial professional and have these conversations with your loved one in the earlier stages, but it may not always be possible. In cases where dementia is advanced, you might need to have these conversations solely with the loved one's financial professional. Now let's look at each of these 5 focus categories and questions you should be asking when considering each of these topics. So number 1, the first thing you should do when meeting with a financial professional is ensure he or she has a complete view of your loved one's assets and how they are currently managed. The professional should also clearly understand your loved one's real estate situation, especially with respect to home ownership. Many older adults incorrectly believe that Medicare will cover their long-term care expenses. In reality, Medicare covers care in a skilled nursing facility only for the first 100 days. So people often need Medicaid to cover their long-term care loss. As you may know, Medicaid eligibility requirements stipulate the individuals must not have assets that could be used to fund their care. Unless these assets have been transferred or gifted to other parties or family members 5 years before applying for Medicaid, a home and any other assets could be confiscated after your loved one passes on to recoup Medicaid or nursing home expenses. So before making any decisions with respect to Medicaid, it's important to have an elder law or estate planning attorney look at your loved one's unique situation. Before we talk about these questions here, I want to remind you that all this information is covered in the Caregiver's Field Guide that I will be providing to you at the end of the presentation. Now let's look at some of these questions you should consider asking a loved one living with dementia when discussing assets. First, what assets do you have, including property, household items, real estate? Whose name are they in? What is their estimated value? This is an opportunity for you and the financial professional to complete or update your loved one's existing financial profile to include all identified assets. Next, consider asking how your loved one's residence is currently titled. Has your loved one considered transferring or gifting the house? Does he or she want to keep the home in the family? Remember, before any decisions are made with respect to transferring or gifting property or other assets, ensure your elder law of estate planning attorney thoroughly examines this situation. Now let's focus on your loved one's income and insurance policies. You and the financial professional should identify all your loved one's income sources, including benefits, where more income could be generated. This also includes all disability payments, Social Security, annuities, and pensions, and how these payments could be affected by other changes in family circumstances, such as the death of a spouse. It's also wise to review your loved one's insurance plans to ensure they fit current and future needs and discuss whether additional policies should be considered to fill gaps in coverage. Many insurance policies and benefit programs have time-sensitive requirements. For example, some plans and services such as COBRA and Social Security disability income are only available to those under the age of 65. Now let's look at some of the questions you should consider asking a loved one living with dementia when discussing income and insurance. First, have we identified all your main income sources, including pensions, Social Security disability insurance, or supplemental security income? Medicaid, or retirement accounts. To get more information about SSDI or SSI, visit the Social Security Administration's website at ssa.gov. Next, you and the financial professional should review your loved one's employee benefits package. You want to determine whether your loved one's current health insurance plan covers care for conditions like dementia or Alzheimer's disease, and you want to know to what extent the coverage applies. Lastly, you should consider asking your loved one about supplemental insurance. This can include long-term care insurance, Medigap, or other insurance policies that have riders. You can learn more about Medigap on the federal government's official Medicare website. Understanding and respecting your loved one's intentions are essential. Intentions refer to your loved one's wishes and how to ensure they are fulfilled. This can involve legal arrangements that have been made. These arrangements often include how the person wants care to be managed and delivered, and this can involve advance directives. Who will be granted legal authority or power of attorney to make decisions on behalf of the person with dementia, and where the person wants to live as the disease progresses. It's incredibly difficult for most people to think about disease progression, but talking about these things early after diagnosis in the mild stage of cognitive decline can help family members learn of their loved one's wishes and help reduce stress later, leaving you time to focus exclusively on their care and comfort. Here are a few questions to consider asking when talking with a loved one about his or her intentions. First, do they have an elder law attorney? Have they thought about contacting one? Elder law attorneys are experts in several subjects, including Medicaid, Medicare, retirement benefits, and long-term care financing. The National Academy of Elder Care Law Attorneys is a good resource to help you find a local attorney. You should also discuss with your loved one wants to appoint as his or her durable power of attorney for finances and health care. And this is vital because as your loved one's dementia progresses, he or she will lose legal capacity, which simply put is the ability to understand information, make a rational decision, and then communicate that decision. If your loved one loses legal capacity before executing a durable power of attorney, which does remain in effect after the individual with dementia becomes incapacitated, legal proceedings may be necessary to appoint a guardian or conservator. This can be costly and time-consuming and could result in someone other than the person your loved one would have wanted to be appointed to act on his or her behalf. And you can learn more about this in the Caregiver's Toolkit. Lastly, you should ask where your loved one wants to live as the disease progresses. During this discussion, you will want to ask whether your loved one has considered moving to assisted living or a nursing home, because these arrangements will likely be needed, and needed well sometimes in advance. People with dementia also need help with tracking expenses, including managing their day-to-day financial affairs, which includes also paying bills. Though you or other family members may have taken over these responsibilities, you should allow the financial professional to help ensure your loved one's banking and financial responsibilities are being met, both practically, meaning bills are being paid on time, and legally. There are several ways you can manage your loved one's affairs. One is to establish a convenience bank account, which allows you or another trusted family member to make transactions on behalf of your loved one. Some families use joint accounts, but these can be also more likely to invite fraud and can cause an unintended inheritance because money in a joint account automatically transfers to those named on the account when a joint owner passes. With a convenience account, the money transfers to the estate when the account owner passes away. Moving on to questions, start by asking your loved one whether he or she has thought about adding services to his or her bank account, such as direct deposit, automatic bill pay, late notification, and overdraft protection? What about creating a convenience bank account with a responsible family member or trusted friend? If you prefer a joint account, be sure to review the gift tax implications, commingling, and the risk of elder fraud. Also keep in mind, in most states, the money in a joint account automatically transfers to the person whose name is on the account upon the death of a joint owner, and this could cause an unintended inheritance and friction within a family. Consider talking with your loved one's bank for other options. It's also a good idea to speak with a financial professional or attorney to help determine which will work best for your situation. Another important question to ask is whether your loved one has considered using a daily money management service. The American Association of Daily Money Managers can help you find a local daily money manager who has signed the organization's code of ethics. And the website also provides consumers with questions to ask before hiring a daily money manager. Finally, your loved one and family must discuss how to finance and facilitate care, especially when the disease progresses and caregiving demands intensify. You should talk with your loved one about his or her preferences for long-term care, for example, in-home care, nursing care, assisted living, and how to pay for it. If your loved one is determined to stay at home, you can work with a financial professional to help you understand the costs associated with modifications or renovations, which may be needed to make the house and home more accessible. Your financial professional might be able to suggest free or low-cost community care solutions along with care management options the family can use. Your loved one may be involved in these decisions in the mild decline stage. However, you may need to work directly with a financial professional if the disease has advanced to the point where the person can no longer participate in the discussion. At this point, it's wise to ask whether your loved one has a long-term care policy that you and the financial professional can review to help determine the extent of coverage as it relates to dementia and Alzheimer's. You should also ask whether your loved one has similar provisions in a life insurance policy or annuity. The U.S. Department of Health and Human Services long-term care page lists several resources designed to help older adults and their families prepare for long-term care, including links to locating benefits, finding home care or assisted living, and connecting with veterans benefits. Next, you'll want to ask your loved one whether he or she has considered hiring a geriatric care manager. The Aging Life Care Association, formerly the National Association of Professional Geriatric Care Managers, can help you and your loved one find a care manager by zip code or company name. However, the site does not screen out or evaluate their listed caregivers. Finally, you may want to determine whether a meal service like Meals on Wheels America would be beneficial. MealsOnWheelsAmerica.org can help you find a program local to you. So this fundamentally brings us to the end of the presentation, and I'm happy to, like I said, pass on copies of the Caregiver's Guide to Financial Strategies for those living with dementia, or to give you additional support material for you or family and friends. And you can also visit this website, transamerica.com /individual/dementia, and obtain more information. There is no cost to obtain it. You can download it from the website at any time. So again, I'll say thank you very much for joining me, Briant Sikorski. You can see here my website. If you have any questions, just go to my website with the innovative address of BriantSikorski.com. And you can see also here in the upper right-hand corner, if you click on the little YouTube icon, it will take you over to my YouTube channel where you can watch this presentation again after it is uploaded, probably tomorrow. So with that, I'll say thank you very much. Have a great rest of your day or evening, and we'll look forward to speaking to you soon.